Hi, welcome. Let's talk about diabetic diet. Diabetic diet is a diet with low glycemic index. It's designed to control blood glucose levels and reduce complications of diabetes. It focuses on balanced intake of carbohydrates, proteins, and fats with attention to portion control. This diet is indicated for patients with type 1 and 2 diabetes as well as moms with gestational diabetes. Key areas to remember: control carbohydrate intake, encourage complex carbs like whole grains, legumes, veggies. Limit simple sugars like candy, soda, and pastries. Encourage carbohydrate counting, consistent meal timing. This helps prevent hypoglycemia and hyperglycemia, especially for patients on insulin. Also, encourage balanced macronutrient intake. We encourage patients to take healthy and low fat protein as well as healthy fats. Encourage high fiber intake. High fiber foods improve glycemic control as well as helps the patient feel full for longer so they don't keep snacking. Also encourage low sodium foods and healthy fats. In my plate, it's recommended that at any given time, any meal, your plate should have at least 50% carbohydrate, and I mean complex carbs, and then 20% protein and 30% healthy fats. What are the nursing responsibilities? Teach your patients about carb control, portion control, and label reading. Monitor labs like glucose, A1C, and lipid profile. Encourage adherence by when you're recommending the foods they need to eat, which are safe and healthy. Make sure you take into account their culture, their lifestyle, and the things they like so that it can improve their adherence and compliance. Encourage them to know the signs of hypo and hyperglycemia so that when that time happens, when that time comes, they're able to treat it appropriately. Collaborate with the dietitian to individualize meal planning for these patients. Why is carbohydrate counting important for diabetic patients? Carbohydrate counting helps match insulin to carbohydrate intake and prevents glucose spikes during meals. So, the carbohydrate counting, we match it with the insulin you are giving so as to prevent glucose spiking during meals. After eating, your glucose usually goes up, and insulin is supposed to be produced to help push that excess glucose into the cells. But patients who are insulin resistant, like in patients with diabetes, or patients who do not produce insulin at all, so then they need support from other sources. So it's either you're giving me more insulin or you are reducing the amount of glucose you're taking or the amount of sugar you're taking. Thank you for watching, guys, and please comment, like, and subscribe. Support my channel. See you on the next one.